Hi friends, welcome to my channel on Cardiac Essentials. This is Shri Vidya, and today we'll be talking about the heart transplant surgery. It's a major surgery, and people are like, really, it's a very complex procedure, and people get intimidated, and no need to get intimidated. What is a heart transplant surgery? So, what is the procedure? So, it is a procedure wherein a diseased heart is replaced with a healthy donor heart. So, it's the last resort kind of treatment for end-stage heart failure. So, surgeons try, every type of cardiac surgeons try, every type of procedures they can do, and where they give up, where it's completely given up, the last resource is the heart transplant surgery. It's a major open heart procedure which requires general anesthesia, which is done under general anesthesia using heart-lung bypass machine. So usually there are so many recipients in the waiting list, waiting for donor hearts, who are hospitalized. And the number of recipients for donor hearts is, if you talk of the around the world, roughly I would say is around 3,000, and comparatively with the donors available around 2,000. So it's very crucial, and many people are on the waiting list to receive a donor heart. So how is the donor heart identified? A donor is usually identified when they have like something like a brain injury, where there is a death of brain and whose organs are otherwise healthy. So many organs will be successfully healthy, but the brain would have not functioning properly. It will be the death of brain. So these kind of recipients, they are also evaluated. Generally, when you talk of recipients for donor, they are well evaluated and ensured they are good enough, they are healthy enough to undergo the transplant. It's like a long time commitment post-transplant care, and it's very crucial, and the surgical procedure for a heart transplant is very complex. The recipient is generally given general anesthesia, and then they are connected to a heart-lung bypass machine, after which incision is made in the chest to remove the diseased heart. Then the donor heart is carefully sewn into the place, and the major blood vessels are then connected. And once everything is in place, the heart-lung machine is removed, and the new heart is monitored to ensure it beats effectively. And sometimes they use like a defibrillator just to give an electric shock and bring the heart to into place. So donor matching, prior to that they do a donor matching. A donor heart is located and a compatibility chart is drawn, and then it goes through a strenuous process, whether a receiver is on mapping with the donor, and then it goes to the confirmation through tissue typing, and there are many other tests that they do before they do like a donor matching, and after which they do like a recipient evaluation. The recipient also undergoes a thorough evaluation to know their overall health condition and whether they are eligible and whether the patient can take up the heart transplant. Then after which the surgical planning is done. The team sits and plans how to do a surgical approach and what to do it step by step. How do they prepare the patient, the recipient for the surgery? It basically differs from patient to patient depending on the physiology and many other factors, mainly the physiology and the like what are the health conditions, whether the patient is good enough to receive the donor heart. So during the surgical procedure, like I said before, the patient is kept under general anesthesia, and then a median sternotomy, a incision down the center of the chest is made to assess the heart. Then cardiopulmonary bypass, they say. A heart-lung machine takes over the function of heart and lungs, providing oxygenated blood while the surgeon works on the heart. To remove the diseased heart, the recipient's the diseased heart is carefully removed, preserving key blood vessels for connection from the recipient, and then the donor heart implantation takes place. Then the donor heart is very cautiously placed into the chest cavity, all the time monitoring all the necessary connections, blood vessels. The donor's heart blood vessels are connected to the recipient's blood vessels, and the heart is monitored to ensure it's functioning normally. Everything is proper, everything is normal, well under condition. And once the patient's heart, the recipient's heart is stable, the chest incision is closed by the surgical team. And it is a very complex process. It's not like a straight process like we think, everything is like it's God's grace, I would say, and also the patient's health condition is very important, and the donor heart from which donor it is received, how compatible it is. Though surgeons do lot of confirmations clinically whether it is suitable for the recipient's body. The recipient and the donor heart is carefully sewn into place, and the major blood vessels are connected. And once the surgeons ensure it's working, it's properly functioning, the heart-lung machine is removed, and the new heart is monitored to ensure it beats properly, normally, effectively. It's easily said, but the process is very complex. And any surgery, small or big, even it can be keyhole surgery. Any surgery, small or big, pre-operative care and post-operative care is very important. It's the important. Once the surgery is done and doctor declares that everything is normal, generally, many of the patients, they say, okay, rest assured, he is good enough. No, he is good enough, patient are good enough, but post-operative care is 99% needed. 99% out of 100. I would say in heart transplant surgeries, 100% is required. Any patient, even that 1% should not be left. The patient is closely monitored in the cardiovascular intensive care unit, ICU, how the heart is functioning, and then the medications are administered to prevent organ rejection and management of pain. I know a doctor who is very good at pain management. He's a primary care physician, very good at pain management. The patient, it's like once a patient undergoes the heart transplant surgery, it doesn't end there. It's a ongoing medical care and lot of lifetime adjustments it requires. It's a very risky and complex procedure. It's not a straightforward procedure. And like I said, there are only very few of donor hearts available, making it a very selective process. It's like a end stage decisioning of the surgeon. Like everything else fails, and they are in a position, the life has to be saved. There's no other go. That is when the surgeons opt for this heart transplant surgery. Long-term success depends on post-transplant care and medication. It is not something that needs to be ignored. Any surgery, I would say any surgery you take, small to big, surgeons do their part, they save lives. They tell the patients the surgery is successful, the surgery has become successful. We do, surgeons, the patient is then closely monitored in the intensive care unit, and like I said, anti-rejection medications are administered to prevent the body from rejecting the new organ, the heart transplant surgery. Then we usually give few weeks or few months, maybe few weeks. Hospital recovery is generally few weeks. It may take more time depending on the health condition of the patient, how well the patient has taken the surgery. And even after discharging the patient, they need to follow up. They need to give utmost care to the patient at home, bring them for follow-up care, regular follow-up appointments. It is crucial for ongoing monitoring to make sure the long-term success of heart transplant. So it is not as straightforward as it seems. They need screenings, they need evaluations, and then they need medications. The post-operative care is very important. Any surgery, and the second thing is, generally people, they just they give the medication as, okay, 2 tablets in the morning, post-operative, 2 tablets in the evening. Please do not do like that. I know I'm not saying that everyone become a doctor, but please have at least the basic knowledge of the medication that's been administered, and please let know the medical practitioner your allergies, what the patient is, and that will be done in the initial evaluation itself, and maintain the medical record clearly and bring it every time you come to the hospital. With this, I'm going to end today's video on heart transplantation surgery. So wishing you all a good health and long life. God bless.